So this is our overall concept map on diabetes mellitus type 1. We are gonna explain how they are linked to each other on the following slides.
Diabetes mellitus type 1 is an autoimmune response where the body has an absolute deficiency of insulin secretion by the beta cells of the pancreas. The physiological process of acquiring diabetes mellitus type 1 is quite adipathic and not firmly proven. However, there are some links to age, genetics, geography, environmental agents, and viral infections. Physiological research indicates that diabetes mellitus type 1 is triggered by a genetic predisposition in individuals. Caucasians have 20% higher prevalence, who are exposed to putative environmental agents such as viruses or a toxin which develop in the pancreas islets of Langerhans and cause the reaction of autoantibodies, activating autoreactive T cells capable of destroying B cells, which overall results in the progressive loss of insulin secretion. The role of beta cells in the body is to act as a glucose sensor to regulate and produce insulin. The sensors detect rises in blood sugar and respond by releasing insulin to ensure blood glucose homeostasis, which is between 4 to 7 millimoles. In a normal patient, the body breaks down carbohydrates into glucose in the stomach, then the insulin would take the glucose out of the blood and to organs that need it for energy. However, the insulin isn't present to take the glucose out of the blood and to the organs. This causes the liver to release its stored glucose into the bloodstream, but yet again the insulin isn't present to remove the glucose from the blood, causing a mass buildup of glucose in the blood or hypoglycemia. Normally, the kidneys will reabsorb the glucose in the bloodstream during filtration, but because there is so much glucose in the blood, the filtration system becomes overwhelmed and allows glucose to pass into the urine, causing glucosuria. Glucose in the urine causes polyuria. This is due to the glucose being an osmotically active soluble which attracts water particles. Thus, when glucose is passing through the filtrate, large amounts of water is following it into the urine. This further causes dehydration because of the excess water lost in the urine. Diabetes ketoacidosis is a consequence of diabetes mellitus type 1, caused as a result of the complete lack of insulin secretion. The body's cells don't receive glucose for fuel, so the cells compensate by burning fat because it doesn't require insulin to enter into the cells to gain energy. The fat burn releases highly acidic ketones in the blood and urine, which is potentially life-threatening. It causes symptoms such as hyperventilating and fruity breath.
The risk factor associated with the type 1 diabetes mellitus. According to the Diabetes Australia and the National Institute of Diabetes, Digestive and Kidney 2017, the exact cause of type 1 diabetes is idiopathy and is still unknown, but it has a strong link with family. A person with a parents or siblings with type 1 diabetes has an increased risk of developing the condition. Another factor is genetic. The presence of certain genes which is transferred from parents to children indicates an increased risk of developing type 1 diabetes. As well, age is also another risk factor. Type 1 diabetes usually develops in younger adults and children. It is one of the most common chronic conditions that develop in childhood. Children are typically younger than 14 years old when they appear the signs and symptoms. Types of diabetes might occur at any age, although developing type 1 diabetes later in life is rare. Geography may also cause the type 1 diabetes mellitus. As people travel away from the equator, they have high risk of having this condition. Moreover, environmental factor. Individuals with a genetic predisposition that are exposed to putative environment agent can trigger the body's autoimmune response that destroys the beta cell and cause the progressive loss of insulin secretion. Similarly, viral infection. Certain infections like mumps, rubella, rotavirus may trigger the development of type 1 diabetes by causing the immune system to turn against the body instead of fighting with infection.
Diagnostic testing can be used to diagnose regardless of any type of diabetes. Blood tests can be used to diagnose diabetes, which is diagnosed based on plasma glucose level. Oral glucose tolerance test, also known as OGTT, is the gold standard for the diabetes diagnosis. A glucose tolerance test measures how well your body is able to absorb glucose or sugar after you ingest 75 grams of sugar. Another blood test is called HbA1c test. It is also known as A1c test or glycated hemoglobin test. By seeing the percentage of the glycated hemoglobin in red blood cells, you can diagnose if the person would have diabetes or not. The table at the bottom of left shows the criteria for the diagnosis of diabetes. For example, if fasting plasma glucose level is 7.0 millimole per liter or over, 2 hours plasma glucose during OGTT is 11.1 millimole per liter or over, or HbA1c test shows 6.5% or above, should be considered to be diagnosed to diabetes. In addition to that, if a patient shows symptoms of hypoglycemia or hypoglycemic crisis, BGL can be tested, and if a random plasma glucose level indicates 11.1 millimole per liter or more, it should be considered the patient would have diabetes as well. Urine test is easy way to diagnose diabetes mellitus type 1, although it is not as accurate as blood tests. When glucose present in urine, it can indicate the person would have diabetes. When ketone is also positive from urine test, it shows a possibility of ketoacidosis, as it is one of the common diseases of diabetes mellitus type 1.
The medication management of type 1 diabetes mellitus is lifelong insulin replacement through insulin injection, insulin pen, and insulin pump. There are 5 types of insulin. Ultra short acting insulin. This is a clear insulin and it starts to work within 15 to 20 minutes after injecting. So it is important to eat within 15 minutes of taking this insulin. It helps to keep our blood glucose level within target range after a meal. It has a peak action 1 to 2 hours after being injected but continues to lower blood glucose levels after another 4 to 5 hours. For example, Novorapid, Humalog, and Epidra. Short-acting insulin. It is a clear insulin and it starts to work about 30 minutes after injecting. So it is also important to eat 20 to 30 minutes after taking this insulin. It helps to keep our blood glucose level within target range after a meal. And it has a peak action 3 to 5 hours after being injected but continues to lower blood glucose levels for another 6 to 8 hours. Some of the examples are Actrapid, Humulin are intermediate acting insulin. It is a cloudy insulin and it should be gently shake or rotate to ensure the insulin will work effectively. It starts to work about 1.5 hours after injecting and it usually given once or twice a day. It has a peak action 4 to 12 hours after being injected and lasts for 16 to 24 hours. Some of the examples are Protampen, Humulin, and PH. Long-acting insulin. It is a clear insulin and provides a constant slow release of insulin over 24 hours. It is given as a basal dose of insulin and should be injected at the same time every day. Some of the examples are Lantus, Levemir, Toujeo. The last one is mixed insulin. It is also a cloudy insulin. It contains two insulin types in the one injection. An intermediate acting insulin combined with either an ultra short or a short acting insulin effect. It should be gently shake or rotate to ensure the insulin will work effectively. We should have to consult the doctor about how soon to eat after injecting. It will be either immediately after or 20 to 30 minutes after. It depends on the insulin types. It continues to lower our blood glucose level for 24 hours. Some of the examples are Novomix 30, Humalog Mix 25, Humalog Mix 50, mixed rate 30/70, mixed rate 50/50, and Humulin 30/70.
Clinical management of the type 1 diabetic mellitus, dietary management, insulin therapy, regular visual monitor, physical activity, and self-management education. Diet plays a vital role in the person's health, especially people with diabetes with their visual depends on their food intake as well as energy level. In the healthcare system, people with diabetes are referred to dietitian in order to manage their diabetes with healthy eating habits. Insulin therapy. Diabetic type 1 mellitus insulin therapy is primary source to maintain the normal glycerin level in pancreas. The main goal of the therapy is to understand the underlying physiology of insulin and safe control of hyperglycemia with normal insulin level. Regular visual monitor. Regular monitoring of glucose level helps to manage the diabetic. It also helps to prevent and identify any pattern of change that needs to address immediately. Regular monitoring visual can reduce the complication and risks of diabetic. Physical activity. Physical activity such as daily exercise, plan, walking, and light work is necessary to manage the diabetic by consulting with health professional. Regular physical exercise improve health condition of diabetic patient by maintaining the healthy body mass. Self-management education. Self-management education can be provided by multidisciplinary team in order to control and manage the diabetes. It is important to provide education on importance of regular monitoring of blood sugar level and insulin level dose to prevent the complications. Healthcare professionals' approach can also help to maintain overall health and well-being of diabetic patient.
Diabetes is a complex condition that affects many parts of a person's body. The potential complications of diabetes are the same for type 1 and type 2 diabetes mellitus. Hypoglycemia is a short-term complication and it is a side effect of insulin or other diabetes medicines. It is a more common problem in diabetes mellitus type 1. It can also be affected by diabetic person's diet and physical activity. For example, if you skip or delay a meal, your blood glucose could drop too low, thereby develop hypoglycemia. Symptoms of hypoglycemia include sweaty, hungry, blurred vision, and if it is severe hypoglycemia, you may develop symptoms such as unconsciousness. Kidney disease is a long-term complication. Approximately 1 out of 4 adults with diabetes in Australia develop this complication. The kidney is damaged due to high blood glucose level and high blood pressure. As a result, problems in kidney function happen, such as difficulty in filtering waste, controlling hormone, and balancing the amount of water in the body. Another long-term complication is developing foot disease. Because of high blood glucose and fat level, your nerves can be damaged. As a consequence of nerve damage, called diabetic neuropathy, tingling, pain, losing feeling in your feet, sores, and infection can be caused. Changed fluid levels, swelling, or damaged blood vessels in the eyes due to high blood glucose level can cause eye disease. It can be either short-term or long-term disease depending on how severe it is. Poor vision and blindness can be the symptoms of this complication. Lastly, one of the severe problems in diabetic patients is developing cardiovascular disease and stroke. Over time, high blood glucose from diabetes can damage your blood vessels and the nerves that control your heart and blood vessels. Also, high blood glucose level from diabetes can change the blood chemistry and increases the risk of high blood pressure. The longer you have diabetes, the higher chances that you'll develop heart disease or stroke.